Hi, welcome to naturalpainkillerguide.com. Today I want to talk about asking yourself some questions when you take painkillers, and really what questions to ask, and what to look for when you're choosing something to take away your pain. The first one, which is an obvious question, is does it work? So is it effective at reducing your pain, or at least providing some kind of pain relief, pain management? um, how when you take it, how quick will it actually work for you as well? So that's the first one, and that's probably the main question that people, when they're suffering from pain, ask themselves. They just want the pain to go away, understandably so, and they grab something that works. So that's the first question that you need to ask, and probably the one that most people do ask. The second question is how does it work? Now, this is a question I think that when people are suffering from pain, they probably don't ask this question, and maybe it's not a concern for them. It should be a concern for you, because of the long list of damaging side effects that it can occur, which can be quite severe in actual fact. And So how does it work? Now, underlying that question is what you're taking, the painkilling drug, supplement, whatever, is it interfering with your natural bodily processes, or is it improving your natural bodily processes? So is it in some way assisting what your body is trying to do, and is it aiding any potential healing, or is it just manipulating hormonal production, blocking pain, but really doing nothing else to improve your level of health? And the third question, which kind of leads on to this one, is it going to have a negative or a positive effect on your overall health? So if the drug you're taking is actually reducing the pain, so it's answering number one, but it's providing it's giving your body increased levels of toxicity and damaging other areas of your body at the same time, and then really it's having a negative effect on your overall health, and you're really on a vicious cycle if that's the case, and the pain will just continue. The degeneration that's occurring, and the damage that's occurring with the resulting pain will, of course, it won't get any better. So is it having a negative or positive effect on my health whilst I take this painkiller drug? And really, am I answering why I'm in pain in the first place? So another important question is, will I get less of a pain relieving effect the more I take it, or will I need to up my dosage to get the same effect? Often with painkilling drugs, you become resistant to it. So this is a slippery slope to be on. The more you take, the more you need to get the same effect, which is increasing the level of toxicity, the damage that's being done internally to you, the corresponding side effects that are happening, and your body's becoming more and more toxic, just to stay on top and manage the pain. And it becomes just less and less effective as time goes on. So that's not a good situation to be in. Another important question is with its pain relieving effect, will its pain relieving effect improve over time without me needing to up my dosage? So links to the previous question. Obviously, if I can take something and it has a cumulative effect in that, over time I can actually take less and get the same pain relieving effect as I had previously, or even more, without providing any damaging and toxic effects to my body, then this is a great thing. So this is what we're really looking for. We don't want to go down the road of having to take more and more and more of something to get the same effect. So same question. So it's an important question. will its pain relieving effect improve over time without needing to up my dosage? So please ask yourself that question. It's an important one. Is it toxic, and if so, how toxic? It's a difficult one for you to measure without doing research, but when you're looking at toxicity, it's about how long does this substance stay in my body, how easily can my body break it down and remove it and expose and dispose of it, and what damaging effects will it actually have whilst it's in my body. Different drugs, for example, will have different degrees of toxicity. Non-steroid anti-inflammatory drugs can have a fair degree of toxicity and damage over time. So just bear that in mind. It's again very important to know. And is there a long list of known side effects associated with you taking the painkiller that you're on? Obviously, that links into how toxic it is, because the side effects are really just evidence to you. It's showing you that how toxic the drug is. That's why you're getting side effects. And sometimes a drug is passed, they weigh up how effective it is at producing the result they're looking for against how toxic it is and how many side effects it produces. And if they decide that in the short term the desired outcome that they're looking for is better than the toxicity and the side effects, then that's how a drug is passed. However, they're normally short-term studies, and they're not really looking at the long-term picture of those damaging side effects. So another one to ask yourself is, are there any known addictions to the painkiller? So many people become dependent on painkillers, and that's why some chemists now and pharmacies are actually really keeping an eye on how many painkiller drugs they're giving out, because they're aware of addictions to painkiller drugs. And does it interact with any other drugs that I'm on? So obviously that's important if you are on any other medication. So these are questions that I asked myself when looking to take a supplement that would be as effective at reducing pain as painkiller drugs, but without all the damaging side effects and without introducing any more toxicity to my body. And also, if I could find something that actually gave me a lot more health benefits, improved my level of health at the same time, excuse me, without actually just reducing the pain that I'm in. So if I can take something not just when I'm in pain, but at a maintenance level that's continually making a positive impact on my health, maybe I might up the dosage if I'm expecting to be in pain for a particular reason. Maybe it's a certain time of the month or an activity that I do that normally induces that pain. I can up the dosage. Obviously, with painkiller drugs, you normally only take when you're in pain. If something and the reason for that is because it's not really doing you any good. Why take it when you're not in pain? So again, the supplement I've found and been taking myself personally for the last 2 years now, recommended to friends, family, and customers, is an enzyme called serapeptase. It's been used actually by doctors in Europe and in Japan, and with some absolutely amazing effects. Not just for one area of the body. It can reduce pain in multiple areas of the body. So regardless of where you're suffering that pain, it could be a migraine, joint pain. You could have pain absolutely anywhere, from an injury or from a long-standing problem. It's going to have a very positive effect. In fact, it's been compared to a viable alternative to very strong drugs like the non-steroid anti-inflammatory drugs, but again without all their harmful side effects. Now the positive effects over and above just reducing the pain, and it's very effective at that, is it's very effective at dissolving blood clots, unwanted blood clots. So it's very good for your circulatory system, preventing the chances of you having heart disease. It breaks down old scar tissue in the body, visible scar tissue, so things like stretch marks and scars, but also internal scar tissue. That's quite amazing because it's actually regenerating your body. Normally once damage is done, we don't really have a way of repairing it. This goes a long way towards doing that. Dissolves arterial plaque in the blood vessels. It can break down cysts and fibrous tissue, even in the lungs as well, for example. So amazing enzyme. Our body does produce enzymes that do similar jobs, but unfortunately, as we age and become deficient and imbalanced in micronutrients, we can make less and less of the enzymes to do this. So it's a great way of making sure we have a good supply of an enzyme, a very powerful enzyme that not only reduces your pain, but also has many positive effects. So if you want some yourself, you're welcome to click on the link at the bottom of the page. If you go to my website, naturalpainkillerguide.com, and find the product page, you'll see a picture that will take you to a page where you can buy the very same brand of serapeptase that I buy and recommend. That's the one I know that works. It's in a fantastic biological level of activity, so it's very powerful and very safe and effective. So yeah, it's the one I take if you're looking at how many supplements can you afford. This is my number one recommendation for you. It's it's fantastic. Obviously address your diet and lifestyle. Focus on an anti-inflammatory based diet. I've got some information about that on my website at naturalpainkillerguide.com. But if your alternative is taking painkiller drugs or serapeptase, it's an easy answer. Absolutely easy. So take care, and I look forward to speaking with you soon. Cheers. Bye-bye.